SNS College of Physiotherapy. Today we are going to see a case study video based on the elbow joint. Here we present my mentees from the first years. They are going to render this video with their thoughts and their learnings. So as they have learned their anatomy and they are going to render the informations which will be valuable to understand, to learn and to implement in our clinical practice. Let's go into the video and we'll start from the first of the introduction to conclusion.
Hi, I'm Anusha, studying in first year BPT. Today I'm going to talk about the introduction of elbow joint. Elbow joint is the joint between lower end of the humerus and upper end of the radius and ulna. The elbow joint includes humeroradial and humero-ulnar joints. It also includes superior radio-ulnar joint. The type of elbow joint. The elbow joint is synovial joint of hinge variety. It is a complex joint as it includes more than one bone for the formation, that is humerus, radius and ulna. Thank you.
Hi, myself Kavya. I'm studying first year BPT. Today I am going to explain about the articular surfaces of the elbow joint. Upper. The coronal fossa lies just above the trochlea is designed in a manner that the coronal process fits into it in extreme flexion. Similarly, the radial fossa just above the capitulum allows for the radial head fits into it in extreme flexion. Lower. The upper surface of the head of the radius articulates with the capitulum. The trochlear notch of the ulna articulates with the trochlea of the humerus. The elbow joint is continuous with the superior radio-ulnar joint. The humeroradial, the humero-ulnar and the superior radio-ulnar joint are together known as cubital articulations. Thank you.
Hi, I'm Kirtisha. Now I'm going to talk about ligaments which present in the elbow joint. There are three ligaments present in the elbow joint: capsular ligament, ulnar collateral ligament and radial collateral ligament. Capsular ligament has three branches. It is attached to three types. Superiorly, it is attached to lower end of the humerus, and medially it is attached to trochlear notch of the ulna, and laterally it is attached to annular ligament of the radio-ulnar joint. And ulnar collateral ligament is also known as medial collateral ligament. Ulnar collateral ligament is in triangular in shape. This extends from medial epicondyle of the humerus and extends to the base of the ulna. This band has thick anterior and posterior bands. Hence, this is an ulnar collateral ligament. And radial collateral ligament is also known as lateral collateral ligament. It is in fan shaped. It extends from the lateral epicondyle of the humerus. Thank you.
Hi, I am Sivaranjan. I am now going to talk about the relations of elbow joint and the bursae related to elbow joint. Relations anteriorly brachialis, median nerve, brachial artery and biceps brachitendon. Posteriorly triceps brachii and anconeus. Medially ulnar nerve, flexor carpi ulnaris and other common flexors. Laterally supinator and extensor carpi radialis brevis and other common extensors. Break.
Hi, I'm Balaji, SNS BPT first year student. Let's talk about nerve supply of elbow joint. Elbow joint receives the branches from the following nerves: ulnar nerve, radial nerve, musculocutaneous nerve through its branches of brachialis and medial nerve. Movements of elbow joint. Elbow joint occurs two movements: flexion and extension. Flexion is caused by brachioradialis and biceps brachii. Extension is occurs by triceps brachii and anconeus.
Hi, I am Sanjay from BPT Sanjay. Hi, I am Sanjay, BPT first year student. I would like to tell about carrying angle of elbow joint. Carrying angle definition. In extended forearm, carrying angle is angle of deviation of long axis of forearm and from the long axis of arm. There are three types of carrying angle: normal carrying angle, cubitus valgus carrying angle, cubitus varus carrying angle. Normal carrying angle is 11 degree to 17 degree, 3 degree more than in females. Cubitus valgus is greater than the normal carrying angle. Cubitus varus is lesser than the carrying angle. These are the types of carrying angle, and these are the information about the carrying angle of elbow joint.
You have seen this full video from the intro to the carrying angle. So they have experienced and they have told what they have learned from the anatomy. So these things will be useful for your learning purpose and also for the clinical things. So how to measure and what are the degrees, what are the muscles and what are the actions, what are the burst rate, all these things will be helpful for the learning purpose. So we'll meet on next video with a new content. Thank you.